Well, hello, everyone. It's great to see you and great to be with you all. Thank you for joining our Healthy Moms, Strong Babies webinar. And I'm Stacy Stewart, President and CEO of the March of Dimes. And we're really grateful to be able to bring this webinar to you all today. We're going to be talking about a really important topic. I know a lot of you all care deeply about these issues of what to do about school. And whether you're a parent or you're a teacher, you have young kids, you have a newborn baby with school-age kids, everybody's sort of really trying to figure out what to do, or you're a school administrator, or you're a physician or a pediatrician. Everyone's trying to figure out what to do about school reopening and how to think about back to school. And, I think it's pretty fair to say that we are really in uncharted territory. I don't think we've ever gone through something like this, most of us in our professional careers or our lives. So we're all trying to be very patient with each other and try to be very understanding. But I think all of us care deeply about our kids and whether or not our kids are going to be able to access quality education and what that really looks like for many of them in just a few weeks. So, and then we also have a lot of parents and expectant moms who have a lot of questions about how to keep their families healthy if kids are going back to school. How do we make sure they stay safe in schools, they stay healthy? How to make sure they're not bringing something back to folks in the home? How do you manage if you're a working parent, you have kids in school, or you have distance learning going on at home? How do you balance that with being able to work as well? So there's just so much that we have to deal with, so many things to have to consider. And I'm really, really so excited about the panelists that we have today. We're also going to be touching on some important topics like vaccinations, and we're already seeing a lot of reports that kids are not getting or may not be getting their typical vaccinations that they would be getting at the beginning of the school year because things are not normal, and what risk that may be posing to them or to others around them. So we're going to talk about that and back to school physicals. We're here to really answer your questions. So as usual, if you've got questions for our panelists, feel free at any point in time to put those questions in the chat box on Facebook Live, and I will see them and I'll be able to pose them to our panelists and make sure that we can get your questions answered, and make sure that any worries you've got or concerns that we can hopefully do our part to get them answered for you as best we can. So with that, I want to just turn it over and introduce our panelists for today. I want to thank them for being here. All of these gentlemen and our guest parent are so busy right now that we can't say thank you enough for the time that they're taking just to be here and share their expertise and their wisdom with us. I want to start just by introducing Dr. Brian Bricado. Dr. Bricado is an obstetrician and gynecologist who specializes in high-risk maternal and fetal medicine in Birmingham, Alabama. He is a fellow of ACOG, the American College of Obstetricians and Gynecologists. He has advanced knowledge of obstetrical, medical, and surgical complications of pregnancy. He knows all about moms and babies and how to keep them safe. He also volunteers his time as obstetric lead for the Alabama Perinatal Quality Collaborative. So he's doing a lot in Alabama to make sure that moms and babies all across the state are really healthy. So Dr. Bricado, thank you for joining us.
Thank you.
And next I want to introduce Dr. Francis Rushton, who is a board certified pediatrician from Beaufort, South Carolina, and he made sure that I said it correctly for Beaufort. It's Beaufort and not Beaufort, South Carolina, like some might be tempted to say. Beaufort is a beautiful part of South Carolina, and he's actually not there right now. He's actually in Alabama too, but he spent a good chunk of his career with Beaufort Memorial Hospital. He's a fellow of the American Academy of Pediatrics and a former AAP board member. He also has over 44 years of experience with research and publications on child safety and well-being, the family-centered medical home, and mitigating and preventing the impact that toxic stress has on young children. So Dr. Rushton, thank you for joining us as well.
Thank you.
Next is Michael McCormick. Michael is the superintendent of the Val Verde Unified School District in Paris, California. That's in what's otherwise known as the Inland Empire, just way east of Los Angeles in Southern California. He is known for his passion in innovation and helping kids reach their goals to achieve higher education. In 2019, the Val Verde School District was recognized by the Leadership Policy Institute as the California school district that is beating the odds by closing the achievement gap for Black and Hispanic students. He's also really active on a number of boards, including Google's K-12 advisory board, focusing on successful implementation of instructional technology in K through 12. So clearly he knows a lot about what it looks like to virtualize education and what it looks like to balance a lot of competing interests as he's looking at reopening the school year. He's also been a great friend and supporter of the March of Dimes. So we're really grateful for Michael, you joining today. And then also our friend and our mother, representing the mother's point of view on the panel, is Wendy Labarge, who also happens to be a teacher. And she's entering her 6th year teaching at Newtown High School in Sandy Hook, Connecticut. She teaches English and American literature and serves as advisor for a number of student-led groups. And in addition to teaching, she and her husband are proud parents of a 4-year-old named Paige and a newborn 3-month-old Theo, who's hopefully upstairs napping unless we hear him waking up and wanting his mom. We'll be patient with that for sure. And of course, he was delivered during the pandemic. So Wendy's got a lot of things she can share about what it looks like to be a mother in the midst of a pandemic with small kids, some of them going to school, some of them at home, trying to keep everybody safe, and being a teacher on top of all of it. My goodness, I don't know how you're going to manage, but we're all going to learn a lot from you, Wendy, I'm sure.
Thank you.
So I'm going to moderate today, and then we'll go through and ask each of the panelists to sort of give some perspectives initially. We'll have some open discussion, and we'll be looking out for your Facebook questions. We'll also be putting some cool things in the chat, I'm sure, to share information as things are brought up on the webinar that might help you in terms of your follow-up or additional resources. So I'll start with Dr. Bricado. And Dr. Bricado, you're a specialist. You take care of high-risk pregnancies. Just give us the update right now on what we're learning and what we know right now about COVID-19. You know, the science is changing, the data is changing so much. You know, each and every week we're learning more. So give us the update on what we know about COVID-19, how it affects pregnant women and their babies.
You know, we've actually had some change in the last few weeks. When the pandemic started, the question was, are pregnant moms affected? Do they have a greater chance of being sicker with COVID than the general population? And when it first started, it didn't look like that was the case. That although pregnant women can get COVID just like anybody else can, they have the same susceptibility. At first, it didn't look like they were getting sicker, but there actually is some literature or evidence to suggest that's come out over the past few weeks that maybe they are at more risk. And the truth is that's something that we see in other respiratory viruses. That's common with the flu, that although most moms who get a respiratory virus like the flu or COVID, they'll get over it too, like the majority of folks. But when you look at a large group of women, it does look like that pregnancy may be a risk factor. They're more likely to need ICU care or go on a ventilator. And that's really what's worrisome to us.
That is worrisome. So if a woman is pregnant today, and let's just say she also has school-age kids, like Wendy was in the situation just a few months ago, although you know, we weren't in school, you know, probably at the time, or maybe school was ending right around the time you were having your baby, Wendy. What advice would you have, Dr. Bricado, what do you say to pregnant women who may also have school-age children on what they need to do to keep themselves safe and what risk their kids may have in terms of this? And we'll also ask Dr. Rushton about this as well.
Sure. And I think one thing that I should add on to what I said last time and would apply to this, it looks like the good news is that I don't think there's a major risk of transmission to the fetus or to the baby while the baby's still in the womb. Now, you're going to read reports that that's been proven, but that does not appear to be the majority of cases. And so the good news is it doesn't look like if a mom who's pregnant gets COVID that they're going to transmit it to the fetus. But what I am telling our patients is, listen, what I think is good news is these preventative measures work. So the social distancing, wearing a mask, washing your hands, hygiene, that stuff's important. And I think we do now know that that stuff works. So my recommendation to folks is to follow those rules. Um, and then, at the same time, you have to keep a healthy state of mind. And so we want them, even though we're following these social distance rules and isolation, it is important that you're getting outside, making sure you're still having contact with the outside world. You still have that support system around you.
That's right. Well, and then the wearing the mask is really important. The social distancing, hand washing, all those things. So we have to do what we know works and try to do that as consistently as possible. Dr. Rushton, thank you, Dr. Burkhardt, and we'll come back to you in just a second. And Dr. Rushton, I'd like to turn it to you and just, as you're a pediatrician, you're obviously seeing a lot in terms of the impact this is having on children. Tell us about what your concerns are about, and I'll just get right to it, about children going back to school in the midst of a pandemic. What are your concerns overall, and what are you really suggesting or thinking? I mean, if you had a magic wand and could say this to all the school systems in the country, what would be your wish in terms of school reopening and how we might go about doing that?
Well, thanks for the question. Or maybe not thanks, because it's actually a very difficult question.
It's very difficult, yes.
And there may not just be one question. I've actually been impressed with the public health authorities and the school administrators, how they've really stewed about how they're going to best accomplish getting kids back into school. And I have to point out that schools are really important to young children. In addition to being centers for education, they're really centers of well-being for children. The impacts on mental health and nutrition by not attending school are substantial. The longer it takes schools to get restarted, the more kids that we are not going to be able to ultimately re-engage in education. We are losing and are continuing to lose children in terms of their ability to continue to learn permanently as a result of this pandemic. And so it's important to us as pediatricians to see kids back in school as soon as possible. Now, some good news is that infants appear to be less likely to get the disease, approximately 50% less than people of other ages. In most respiratory virus epidemics, they're often driven by kids in school. Kids pass the virus around school and then they take it home to their families. This appears to be less so with coronavirus, although we do estimate that a substantial number of lives were saved by stopping school in mid-March and sending kids home to a virtual learning environment. We do know that children seem to have less symptoms. That may not be true with infants. Infants have double the hospitalization of older kids. That may just be because we worry more about infants than we do the older kids. It's not real sure whether they actually get sicker or not. Kids who are in elementary school or pre-elementary school tend to have mild disease and tend not to transmit it anywhere near as much as older kids do. Kids who are in middle school or high school are on a gradient, and they become more and more like adults every year in terms of their susceptibility and the symptoms that they have. And so in many cases we've seen, well, not many cases, in some cases we've seen school explosions of disease in kids who are middle school, high school age. Somewhat curiously, 11th and 12th graders seem to have less problems with it than 9th and 10th graders, and we think this may be because the older kids are just better able to follow social distancing advice.
So I think everybody, and we did have a Facebook question, so I usually wait on those, but I'm going to go ahead and jump into it because it's exactly the question I want to ask. So I think everyone agrees with you that we all believe that the best place to be for kids is in school. But we also know that there's so many communities where the transmission rate of the virus is so high that it feels very unsafe, and it feels like it's not the right decision. So what conditions do you think would make it safe to send kids back to school? What are the things that would make us all feel better that kids can go back to school and still be safe at the same time? What needs to be happening in the schools to make that happen?
That's such a good question. I mean, I think that schools have been wrestling with this over the past couple of months and are still wrestling with it today. And some may make new decisions tomorrow as a result of the new data that's just come out. But I think that you need to get the rate of transmission of the virus down to a rate that can be managed by contact tracing and testing. And in big parts of the United States, we've not done that. They have reopened schools in New Zealand with some success, but they beat the virus back before they reopened schools. They're now currently opening them in Malaysia. They're doing it in a stepwise fashion. Schools never closed in Sweden, and the per capita rate of coronavirus infection across the entire population was essentially double of what it was in the Nordic countries that were on either side. But there were no big outbreaks of coronavirus. Israel, they got their rate of virus transmitted down. They opened up schools, and there's been a huge explosion in Jerusalem now in their school system and in the general population as a result. There is a lot of conversations going on right now as to why it did not work in Israel, but why did it work in the Nordic countries, and seems to be working in Malaysia, and other countries have already started school. I think the main answer to your question is that unless you get the rate of community transmission of the virus down to a more acceptable level, you're not going to be able to reopen schools successfully. And some communities in the United States have done that, and others have not. South Carolina and Alabama, where I am right this second, have not. And I think most of our schools are backing off from earlier plans to reopen in-house school.
And that rate of transmission, that level, do you think that you'd find acceptable to reopen schools is what, do you think?
I think that if you talk to different experts, they'll give you different answers. There was an answer published in the New York Times last Friday, and I don't have it right in front of me in terms of they gave a ratio that they suggested. I think other people have other ratios they're using. When you look at your bell-shaped curve of how the disease is spread across the community, you should be seeing the rates come down, in my opinion, to somewhere coming down 80 to 95% before you start reopening school.
That's helpful. Well, one of the people who's got this very question right in front of him is Michael, who's the head of the Val Verde School District in California, pretty big school district, and you've got a lot of issues going on there and in California for sure. So, Michael, you're a school superintendent. What has been your thought process about what you've been considering as you try to reopen schools? And I'm sure it's not, your decision alone. You've got a lot of recommendations and people talking to you from federal, state, and other local authorities and public health officials and parents and a whole range of competing stakeholders, I'm sure. So where are you now in your consideration of opening schools? What data what are you looking at to make those decisions? How are you making those decisions? And what decision have you made so far in terms of reopening?
Yeah, well, thank you for a great question. And it's such a pleasure to be on this distinguished panel today. So our first day of school is going to be August 12th, which is just next week.
Oh, next week. Yeah.
And, we like to say almost jokingly, we've received a tremendous amount of guidance and very little direction. And so it's, one of the things we did is create a task force that included parents, community members, students, certainly staff members, and it was co-chaired by two of our board members, our board president and another member of the board. And we really began looking at all of those guidance documents, federal, state, local. And there was really only one conclusion that we could draw, and it had to do with our community spread in the area of the state of California where we're located. It was to return to school in full distance learning. One of the things that I'm proud of our Board of Education for thinking about is they kind of set a time where they want to go back, and obviously the task force will continue meeting every 2 weeks at a minimum, and we'll continue to look at all the data that's before us in terms of community spread. We've got we're very fortunate to have an outstanding local public health officer who's actually providing data in terms of number of our students tested and the positivity rate of the number of students in our district. And we're about 20,000 students. And so the Board of Education decided that we would start school in full distance learning and reevaluate by October 30th. And kind of the thinking behind that was, you know, for those folks who really want to get their children back in school, it wasn't too far down the road. And for those who were really fearful of sending their students back, kind of the same thing. It gave them comfort to know, okay, between now and October 30th, we'll be in full distance learning and I can keep my children safe. Because one of the great challenges, and then I'll turn it back over to you, is that we have parents on a spectrum. And on one end of the spectrum, we have parents saying, look, I need a safe place where my child is supervised, that they can be, so I can get back to work. On the other end of the spectrum, we have parents coming forward and saying, I don't feel comfortable sending my child back to school until there's a vaccine. And so it's very difficult to meet the needs of both ends of the spectrum. So that's one of the challenges we've faced.
But I think one of the things that I think people are wondering about is, you know, we know that in-school instruction would be the best, right? So if you're making the decision to go virtual, what other accommodations are you planning to make, or are you asking for or support to make sure that kids can get quality virtual learning, access to technology? What about the parents who, you know, cannot be there to, you know, or, you know, can't, maybe working outside the home and the kids staying at home? There's just so many other issues that, you know, I think school districts need to think about to really support quality learning, safe learning at home for kids. So what other things have you been doing to try to deal with those issues?
Yeah, there's certainly school districts that were more prepared for this, you know, initial transition into what we like to call emergency distance learning. And now we're coming back with, you know, we call high quality distance learning, which is very different. And I will say that in my school district, we're about 20,000 students. And for the past 5 years, every one of our students has had a laptop, and that's a take-home device. So they have had access to that in school as well as at home and during the summers. And we've also done a lot of work to ensure internet connectivity, you know, that our students have a stable, high-speed internet connection while they're away from school. And so our initial data that we were getting out of some of our software through the analytics is we had about 95% of our students connecting on a daily basis. And this held true across race and ethnicity, students with disabilities, students learning English as a second language, our students participating in National School Lunch Program, and about 85% of our students participate in the National School Lunch Program. And so we had made some decisions starting probably 10 years ago about building our technology infrastructure, transitioning to the one-to-one devices for our students and our teachers, by the way. Our teachers also have laptops. Our teachers can teach from their classroom or they can teach from home. One of the things that's been important for us is we feel like when we support our teachers, we actually support our students. And so, you know, we've gotten some good funding through the CARES Act, and we've been able to do some things that I think are going to provide a very different distance learning experience than what our families and students experienced in the springtime. And I will just say, you know, one of the concerns has been, you know, how do we ensure and provide services to students who may be feeling depression, increased anxiety? You know, this is a difficult time. And so We've kept track. We've had over 900 teletherapy appointments with our students during the closure. We've served over 600,000 meals, ensuring that our students are still receiving breakfast and lunch on a daily basis. And so, you know, I think certainly we've learned a lot, and there's still more to do. But I think we've tried to be very intentional about creating authentic human relations in a virtual environment. And we think we're
That's
getting
great.
pretty close to solving that.
That's great. Last question. I want to turn over to Wendy just because I want to, and it, because the question also came up on Facebook. You're going to reevaluate until this is going to be in place October 30th. So you're going to be evaluating community transmission and all of that. Is there a point at which you think, or is there a point at which we talked about, our rates coming down significantly? Dr. Rushing talked about that. But is there a rate of transmission at which point, and there may be other factors to think about, but is there a certain rate of transmission in the community that you feel becomes a benchmark that if you reach that, it may become acceptable for the kids to then go back into school? Like what number, is there a particular number that you're looking at or a range that you're looking at?
Yeah, so we some of that has been taken out of our hands through the governor's office. And so the California Department of Public Health would like to see a community transmission rate. And I want to say I'm getting this right, but somebody would please fact check me on this. I want to say it's around 4 to 5%. What we're seeing right now is on the order of about 9%. And so what that means for us is our entire county is on a watch list right now that's being managed by the California Department of Public Health. And so even if our local board wanted to open schools sooner, we would not be able to at this point. So our county community transmission rate has to be on the decline and getting lower. And then eventually the county would work its way off that California watch list. And then what the statute says is we have to be stable for a minimum of 14 days once we come off that watch list. And then we could begin to think about opening schools.
I see. That's good to know. Wendy, you have a 3-month-old, you have a 4-year-old, you're a teacher, and the school year is about to start. So what is going on in your mind about all the different things you have to balance of, first of all, are you guys virtual or in person? You're in Connecticut, right? So what's the situation there, and how are you thinking about all of these competing things? You've got to go back. I assume you're going back to work when the school year starts as a teacher. So you got to keep yourself safe. You got to keep your baby safe. You got to keep your young child safe. What are you doing, and how are you adjusting to this kind of all these competing issues?
So our Board of Ed was actually supposed to meet Tuesday evening, which was the night that the tropical storm came through and we lost power. So our Board of Ed is actually actively meeting right now to decide what is going to be the opening plan for our school year. We start in September. Connecticut historically starts later than the South does. And so I haven't necessarily been processing things yet because we have to, our Board of Ed and our superintendent have put together a full in plan where every student attends, a hybrid plan and a distance plan. We had to present all of those to the state of Connecticut, and then the state has to approve them. And then our Board of Ed is now free and our superintendent to decide what model. And it looks like it's probably going to lean the way the rest of the state has gone, which is likely to be a hybrid distance and in-person learning model. And that's a lot to process. I'm fortunate where both of my children will be in daycare and none of them will be in the school system yet, because a lot of what the hybrid learning model is looking like will be 2 days in school for students, 2 days in a row in school. Wednesday will be a day to clean and disinfect the building, and then a second cohort of students will be in on Thursday and Friday, and then deep cleaning over the weekend. And that is an extraordinary challenge for a lot of parents in the state of Connecticut, and certainly one of privilege if they're able to send their kids on that schedule, because to find a company that might allow you to, have 2 days in office and 2 days at home, or 2 days to work with your kid while they're trying to distance learn, is immense privilege. And I know that a lot of people are talking about different ways to handle that. For me as a teacher, even in that model, I'm in building every day. My understanding is that we will be teaching every day from school. Wednesday we'll be home and doing distance learning there, but 4 days a week. So every day I have to think about, what am I going to do when I get home to disinfect myself? Because I'm a high school teacher, I teach 5 classes that typically have between 20 and 25 students, which is actually on the lower end of some class sizes, as I've seen, but still a lot of kids to come in contact with every day. And they're mingling and interacting with many more kids throughout their building on any given day. And so the amount of possible contact and exposure that I have feels astronomical to me. And that is something that I grapple with. And I've certainly thought about, should I try to do an extended maternity leave this year and not go back? But again, would be a huge place of privilege for me to be able to do that. But thinking about ways to keep myself and my daughter and my infant son safe. And I know our pediatrician and our gynecologist said that, infants have a lower infection rate, but is that because they're insulated? Is it because of something special about them? I think these are still things that moms wonder and worry about, that we trust the science, but again, it's a novel virus, right? What does that mean for us? And the amount of times that we've seen information change, and as we grow and learn more about this particular disease, this virus, it just feels like constant question marks. And am I doing the right thing? And I think the overwhelming thing for probably every parent, and I know every mother that I've talked to, is guilt. How do I know I'm making the right choice? Yes, children should be in school, but if my child gets sick and God forbid something happens to my child, being in school won't have helped them at that point. And I know that's something that weighs very heavily on parents. And I think that's important to note, that as a teacher and as a mother, I know my child does better when she's in school and with other kids and interacting and engaging, but that's up to a limit. So
right. And your kids will be in daycare, and so that's a whole nother issue of what are going to be the standards in daycare? I mean, are they going to be mandating that little kids are wearing masks, and and the workers, and I mean, social distancing with little kids is difficult. So
yeah,
what do you know about the situation with daycare and how that'll keep kids safe?
So our daycare is not requiring masks. I think it would be nearly impossible to get them to wear them all day. And because we do seem to have this evidence that suggests that they have, the last thing that I had seen was a 50% infection rate compared to older children and adults. The teachers all wear masks. There's lots of hand washing throughout the day. They currently have smaller class sizes, but I think as parents get ready to send their kids back to school, their older kids back to school, or if they need to go back into the building if work from home is no longer available to them, because I know a lot of places are starting to push back in, that those class sizes might increase. But for now, she's in a pretty limited class size, my older daughter, and so that gives me some comfort. Again,
I'm sure the daycare providers, though, are really concerned about catching it from the kids, even if the kids don't catch it from each other, right?
Yeah, and as we talk about, and I'm sure Michael has this experience as well, the little kids like to touch, they like to hug, and you can't say don't do that, right? Even my own daughter, I was like, don't go bother your grandmother, she's on a call right now, and of course you say don't, and they hear do, and they go off and do it. So, I mean, it's nearly impossible. So I think as much hand washing as they'll do, I know they use a lot of hand sanitizer, child-approved hand sanitizer throughout the day. They try not to share too many activities at the same time. And right now they're doing a lot of play outside, which is helpful. But as you know, it's New England, up where I am, so it's eventually going to get cold and they can't go outside as much. They'll still go out, I assume, but not as much. And so they'll be, again, brought back into these environments where, you know, maybe ventilation isn't always great, or they'll be more on top of each other, or, you know, it's hopefully things will be different by then, my hope.
So I'd like to open this up to, thank you, Wendy, for that. And I really appreciate how much you're trying to balance a lot of, you're clearly giving a lot of thought to where your situation is right now. I want to throw it open to any of you all to answer. I'll start with Michael, but then any of you all can chime in. We had a question on Facebook about what do you think about starting school without mandated masks? Now, of course, a lot of you all are you know, are in places that are virtual. In Alabama, I'm not sure. I didn't, Dr. Rushner, Dr. Burkhardt, I know you're not involved with the schools directly, but curious whether or not there's going to be an in-person model or not. But Michael, I'll start with you, and then any one of you all can answer about for any school district. You know, what do you think about starting any school without mandating mask wearing by anybody in the school, including the children?
Even in Alabama, we now have a statewide order to wear masks for everyone.
Oh, you do have a statewide order in
Yeah.
Alabama. Okay, good.
I'm
Michael,
sorry.
what do you think about that?
Yeah, so I think at the time that we start school, the expectation from the state of California, the California Department of Public Health, is that our students and our employees would be wearing masks. And, you know, it seems to be one of those things that's been highly effective. I also, you know, agree that, you know, explaining masking and social distancing to 4- and 5-year-olds might be fruitless. But I think that, you know, in California, we will receive from the Office of Emergency Services 4 masks for every student that we serve. It'll be 2 disposable masks and 2 reusable cloth masks. And then of course, we're also building up our own supply at the, you know, at the district level. And so it seems to me, why wouldn't we want to have our students wearing masks? There's been a little bit more controversy actually around teachers. And especially for the early grades, when students are learning letter sound, relationships, phonemic awareness. And what's come to our attention, and it's something we're working towards solving, is the students really need to see the teacher's mouth so that they can see the formation of the sound and begin to understand that letter sound relationship. And the same thing in turn for the students is that the teacher should be able to see, you know, the shape that the student's mouth is making as they're trying to form the appropriate sounds associated with each letter. And so we're looking at options for our elementary school teachers that would be kind of a face shield.
Yeah,
a face shield option. And the science still appears to be a little unsettled when it comes to face shields. We've heard certain things about, you know, a face shield that has a fabric covering attached to the bottom of it, and then making certain that it wraps fully around the side of the face. And so I think, you know, I'm hopeful that over the next, you know, couple of weeks, we might get some more firm guidance on the use of face shields, because I think certainly from an educational perspective, for our elementary age students, it would be much better to have face shields in use than it would be masks.
mm-hmm. One of our volunteers at the, oh, Wendy, go ahead, sorry.
Our district is supplying, my understanding is that we're going to be expected to wear masks as well as have face shields. And we also have plexiglass that is being, and I'm not entirely sure what that's going to look like, if it's going to be on the teacher's desk or not, but that our district, and I think many in Connecticut, since many have hybrid plans where we'll be engaged with students, that we're trying to get as much layers of coverage and protection as we possibly can. And so I think that's part of what you're talking about, is what we're going to see effectiveness up in our neck of the woods.
Absolutely. Dr. Rushton, what is your sense of what you'd like to see in terms of mask wearing in the schools? And have you seen models of where even younger kids have been successful in kind of consistent mask wearing and keeping their masks on and proper hand hygiene and things like that?
I believe I'm quoting the American Pediatrics policy correctly, that under age 2, masks are contraindicated.
Mm-hmm.
From 2 up to either kindergarten or first grade, if you can get the child to wear a mask without it being a major fight, we recommend that they wear the mask. And then from first grade on up, we strongly recommend that everybody be required to wear a mask, at least there's going to be circumstances in elementary school where some kids are going to resist and you may have to give in, but at least as a general rule, everybody from elementary school on up should be wearing masks, and down to age 2, if they'll tolerate the mask, they should be wearing it.
I want to ask a question too about mental health. It came up a little bit earlier, and I think I even saw today, Michelle Obama in her podcast talked about that she's been experiencing some level of depression through this pandemic. I don't think any of us have felt. I think all of us have felt somehow affected in terms of our mental health and our emotional well-being through this pandemic. It's been incredibly stressful. Dr. Brocato, what are you seeing, and kind of how are you addressing this issue of mental health with women that are pregnant, especially women that are now facing these additional challenges of maybe a kid going back to school and how to manage that? What additional advice or support, or how are you addressing some of these mental health challenges that women are seeing, pregnant women? And then any one of you, I'd like to hear it as it relates to kids and dealing with mental health issues with kids. Wendy, probably you've got some direct experience with this too, but Dr. Brocato, can you start on that?
Sure. I mean, the truth is most moms, and I'll say too, I'm a parent myself to 3 young kids. There's a lot of fear. That's the word I would use. And especially there's a lot of fear around the time of delivery. What if they test positive at the time of delivery? And, I've heard really upsetting stories about moms delivering alone without any support person, the baby being separated from them at birth, not seeing their child for days and days. Just that's the kind of thing that we couldn't imagine that was going to happen. That nothing like that has happened in my career, definitely. And so one thing that I'm really trying to talk to my moms about is to not take these situations in their own hands. When stuff like that happens, we start seeing people avoid going to the doctor, not necessarily following recommendations of prenatal care. And so I've really asked them to make sure they're open and vocal with their concerns about their doctor. Especially there's a lot of concerns about delivery. So let's talk about that now. Let's make sure what our policy, what the hospital policy is, so you kind of have a way to plan. Now, the good news about that is American Academy of Pediatricians, AAP, I believe it was a couple of weeks ago, have changed that recommendation that moms who are not sick, who test positive, we're not recommending separating them. They are definitely still encouraging breastfeeding, all those such important bonding moments at birth. But the other thing that we're talking about is, the world for everybody, it's a new world, right? It's not as it was. So the things that we were doing for our own mental health, our self-care, the things that we were doing before, they may not be available. And so, how do we think outside of the box of what can we do to maintain that sanity now? And I said this before, but being outside is a low risk transmission. Social distancing outside is a low risk transmission. And I just think with anything with dealing with stress and fear and anxiety, what is toxic is isolation. And so how can we find a way that is socially appropriate, that's safe, that still connects us?
Yeah, absolutely. And Michael and Dr. Rushton, how are you dealing with them? I think, Michael, you raised it, or I think about the mental health issues and what you all have been doing. This problem is only going to get worse, though. What should we be doing to help with the mental health beyond just even what your school district has been doing, and Dr. Rushton too, to really help so many kids, and even not just even the youngest kids, the high school kids? We're seeing increased rates of depression and potential suicide attempts and things like that with children and young people. So what would you like to see happen with respect to providing more mental health support to our children?
Yeah, I think we're fortunate in my school district. We've got a number of counseling therapists that are available to do the telehealth appointments for those students and families that may really be struggling. We've also got a very robust family engagement center, and they've been doing a lot of virtual work with our families and connecting with them and providing, just the kinds of things that Dr. Mercado was speaking of, is to, the importance of nature walks, spending out time together as a family outdoors. We know that unless somebody in the nuclear family that's living under the same roof is infected, they should be fine together. And so, some of the messages that we're really trying to send out is be a loving parent first. And make sure that you're having that bonding time. And if you're a new mother, we think that breastfeeding and that bonding and skin to skin contact is powerful. We also think that the antibodies that the newborn is receiving it's suggested that that's still very, very important for our youngest students. And of course, our involvement in this is these students will come to the school district at some point, down the road. And so the other thing that we're, through the Family Engagement Center, talking about is just the importance of maintaining that family schedule. And for the adults, make sure you're getting plenty of sleep. We know that when you're well rested, your ability to cope in a more healthy way is increased. If you're doing some family exercising together, and you're eating healthy, and those things aren't always easy to do when schedules are disruptive. But I think the more that families can set the intention to create those times together and be healthy together, eat healthy together, exercise together, that those are some of the things that can help reduce that fear and anxiety that we're all facing.
The stress and the anxiety.
Yeah,
Exactly. Yeah.
exactly.
And, and Dr. Rush, please.
So, my adult daughter, we were talking about being depressed right now, and she said, "Dad, if you're not depressed right now, there's something wrong with you."
I think that's probably right.
So,
Unfortunately.
I think this is a problem we're all having to deal with. But on the American Academy of Pediatrics, healthychildren.org website, they've got a whole list of things to do to try to support mental health for your kids. And I'm just going to list some of them. Simple reassurance: remind children that researchers and doctors are learning as much as they can, as quickly as they can. Give the kids some control. That means teaching them how to do hand washing, how to stay away from people who might potentially be sick, a little bit about social distancing. Give them some positive things that they can do to help maintain some control in their life. Watch for signs of anxiety. Children may not have the words to express their worry, but they may become clingy, crying more and more irritable. And if they are, simple reassurance can sometimes help. And then monitor the media they're watching, especially for the middle-aged and older kids. If there's a lot of horrific stuff on media right now, some pretty violent images. And this is not on the healthychildren.org website. I think there's also a lot of conspiracy theories on the internet that sometimes middle-aged and high school students fall victim to. And there's some thinking that when folks feel out of control and depressed, that they have special knowledge, which the conspiracy theory gives them, and makes them feel like they're in control. And that's why we're seeing so much conspiracy theory problems going around right now. So talking with your kids about what it is they're watching and seeing, and helping get them back in the direction that's more based on what mainstream folks know.
Conspiracy theories on the internet. I never would have guessed that. Exactly. Dispelling all the bad information is really helpful. I agree with that.
Yeah.
There's another question too that came up on Facebook about sports and athletics. Of course, school is primarily there for our kids to learn, but it's also a place, and this is an issue near and dear to my heart, around athletics and PE and school. So what's the situation with that, especially, again, if you're virtual, kids are not in those sort of more structured PE or recreational activities. Are there ways that school systems, Michael, are addressing this? And, but what do you do for high school kids who are really involved in sports? How are the sports schedules changing if things are going virtual or hybrid or whatever the changes are?
Yeah, and I can tell you as a former high school principal that there is a tremendous thirst for high school athletics. In this way, it's really pretty sad because our students are not able to participate in athletics. In fact, our California Interscholastic Federation, who governs all the high school sports, just said that we won't be doing anything until probably December, January timeframe, at which point we'll reevaluate. And there was some football coaches and basketball coaches that were being creative with some of the statutes that had come out from the governor's office and the public health department in trying to get kids to at least get into the weight room and do some light workouts and things. And our local public health officer just reaffirmed that that is not allowable. It will not be allowable for the immediate future. And so everything is really shut down from a system-wide level. Do I think that there's probably some students who are getting together, on their own and doing some workouts? Probably. But in terms of anything organized, and that goes for any youth sports too, that may be happening in the community for our younger students, our elementary and middle-aged students. So it's one of the comprehensive experiences right now that is not allowed. And it is unfortunate because students come to school for a lot of different reasons. And one of my favorite educational researchers has a quote. We know that when kids get good at one thing, they tend to get better at everything else because they begin to build their self-confidence. And so, that's one of the reasons we want to offer a comprehensive experience that includes clubs and activities and athletics and band and choir and theater and dance and, all those things that give kids lots of opportunities to engage. And when they get connected in one of those things, chances are they'll get connected into the other aspects of their educational experience. So I, for one, can't wait for those things to come back because I know it's really, really good for kids.
Yeah, kids need to be able to run outside and play. Little kids need to play. There are older kids who not only play sports, but some of them are really on a track to hopefully get recruited for, college going. And that's, and then we also have the issue of, how this issue of the school closing is impacting communities very differently. And before this call, we talked a little bit about the disparities that we're seeing, where you've got diverse populations and everywhere that you all are in Alabama, in California and in Connecticut. What are some of the concerns you're seeing about this issue of school reopening or going virtual that's even adding to some of the challenges that communities of color are already seeing with respect to the pandemic and how it's impacting communities very differently? And I'll just open it up to anyone that wants to start.
I think this is a profound concern. We know right now that individuals who are of color are more likely to have bad outcomes and more likely to be hospitalized right now with COVID-19. We also, when you talk about education, know that they frequently don't have the technological resources in their homes. Schools are trying to make up for this disparity, but it's hard. Sometimes there's not a signal where they live. This particular pandemic is just emphasizing what we already knew, and that is this is a country that has not addressed its disparities between the haves and have-nots, and we're leaving an awful lot of people behind as a result.
Yeah, absolutely.
I think, not to interrupt, but I appreciate the question. For me personally, and I think what's important just for a community, for us to be aware of that disparity. People aren't, if the practitioners, if the folks making decisions are not aware of those disparities, my senses are up to make sure that that's not happening.
Absolutely.
Yeah, we know in our own school district, in my own school district, we're 75% Latinx and about 14% African American. And we know that, the positivity rate among our Latinx and African American community members is around 3 to 4 times. At least that's what I've seen in the science. And that was one of the things that our board took into consideration in terms of, do we reopen or do we stay closed? And we think there's some contributing factors to that. Many of our families are working in essential services, and so they're out, they're having contact with other people. We also know that many of our families are living in multi-generation homes where you've got multiple generations in the same household and congregate living situations. And so I think those are all very important factors to take into consideration as we know schooling is important, and we want to be able to make sure we're serving our community, but we also want to do our part to make sure we're keeping our students and our families safe.
Absolutely. Wendy, we have one last question. I see Theo has joined us. There was a question on Facebook about what would you recommend a new mom and dad do about people visiting a newborn when they come home, and is the mask enough? So what are you saying? Dr. Ricardo, you may add to this as well, but Wendy, what are your rules in your house about who gets to come over to the house and how do they get to show up?
So Theo was born April 23rd, which we thought was like about the height of the pandemic in Connecticut. We found that obviously not to be true, that things have gone on much longer than that. In the very beginning, we were really strict about it. We were at home just by ourselves. My daughter was home full time with us too. And in the beginning, it was actually kind of nice to be able to say no visitors, no one can come over. You got to live in a little bubble that was just you and your baby, and you got to really get to know each other. My baby is 3 months old now, and he is a giant.
Oh my goodness, isn't he the cutest? Aww.
But he's gotten so heavy, and he likes to be helped like all babies do. And at a point, I was like, I am ready to give him to anybody who will take him from me. About mental health for the mother, and to not have that community around you, to not have people to pass the baby off to, and to give yourself a little bit of a break has been really difficult. My family, my mother and father moved to North Carolina several years ago, but I live very close in proximity to my in-laws, and that's actually where we are right now because our house has no power. But we've kind of broadened our circle a little bit, and because Connecticut has been handling, I think, the pandemic really well, and our transmission rate is very low, I've felt much more comfortable opening that up, but really only to, a small group of people. Most of the people that I know are also educators, and so they've not had lots of exposure to other people, but I think, again, it's that issue of guilt. My in-laws were also with my sister-in-law who's immunocompromised, and so I knew that they were taking all of the necessary precautions, that I felt, okay, bring in this little guy over to see them, and so I think it's just, you have to be okay with telling people no, and that's a very hard thing for women to do in general, to say no when they don't feel comfortable, but that's a word that we have to get better at.
That's what keeps everybody safe. Dr. Mercado, what are you telling your new moms about home visits from extended family, and is that allowed? Is that recommended? Mask wearing? How does that work?
The truth is I think it's case by case. And I do, when you use the word extending your circle, I think there are appropriate folks who you trust, who are following the necessary guidelines, but it's that social support is critical. And so I do think that it's not the same for everyone. Everybody has situations that we mentioned, like if there's someone immunocompromised, if there's a family member that is at a higher risk with chronic lung disease or age. I do think you need to do something different there. But of course, I can't shy away from the fact that social distancing, wearing a mask works. And so, you know, if that is going on, folks are asymptomatic, you know, the chance that they're carrying the virus is low. And so I do think there is a place for it broadening that circle.
Yeah, and every case is different, every community is different, and
right.
everybody's got to make the right decision. Just be responsible, I think is what you're saying, right?
Right.
And if we know mask wearing, hand washing, social distancing works, then try to do that as much as possible, whether you're in school, whether you're at home with family members or friends.
Right.
Well, we're out of time, everyone. I wish we could keep going on and on, but this has been absolutely amazing, and I really want to say thank you. And as we close this out, I just want to just remind everybody that, you know, we try to give as much information as possible. These topics evolve as our world evolves, and we'll continue to bring kind of the right kind of content and panelists to you all as much as possible, and respond to all your questions. So thank you for all the questions on Facebook, by the way. Here are a bunch of links and resources that were either mentioned or can be available to you from the March of Dimes, from CDC. Dr. Rushton mentioned healthychildren.org and some of the resources at AAP. Feel free to visit these links because they can be really helpful to continue to provide information to you. And the last thing I'll just say is if this is really helpful to you, and if you would love to continue to support the March of Dimes and our ability to do this work, please, please, please. Every nonprofit is really, really struggling. All of us have been hit really hard with the pandemic. We need your support to continue to do the great work that we do. We make it really easy by allowing you to text to give. So text MOD GIVE to 51555 to donate. Any amount is appreciated and needed. And so we're so grateful to you all for joining today. Thank you again to our panelists. Thank you, Theo, for showing up and showing your beautiful face to us. And we hope everyone has a great rest of the afternoon. Thank you so much.